My name is Carolyne Ogamba, Superior Student Nurse, and I'm here to record a video for clean void midstream, also known as mid-catch. So, ready? I've verified the order in the medical record. I have reviewed policy and procedure. I have gathered my supplies, which is the specimen container, the label and the biohazard bag and the towelette and sanitizer and my gloves. I'm now ready to go to my patient's room. I will not provide privacy, introduce myself. And hi, my name is Carolyne Ogamba, Superior Student Nurse, and I'm here to perform perform a specimen collection for urine to determine why you're having difficulty urinating and to rule out UTI. Can you please state your full name and date of birth? It matches, and I'm now going to check the specimen label container with the ID band of the patient. The specimen label should contain name and patient identification number, the route of collection, the date and time it was collected, the person who is collecting the procedure. So because my patient is ready he can go to the bathroom by himself. Do you need assistance to go through the bathroom? He says no, he can do it by himself. I will explain the procedure to him and tell him that when you go to the bathroom, make sure you wash your hands first before you start the procedure, and use this towelette to clean your meanders around in a circular motion from inside going outside. Meanders, which is the hole, because my patient is male. And you're going to, don't defecate inside the specimen. And then when you're opening the lid, make sure you open the lid facing upward and making sure you don't contaminate the lid. And then you will need to close it in a seal. And then void around 20 to 30 ml in the toilet stop, and then continue, then use this to collect around 10 to 20 ml, making sure the container or the inside does not touch the perineal area of the hair, and making sure that you don't put the toilet paper inside the specimen or don't defecate inside. So I'm going to perform hand hygiene and put on gloves as I wait for my patient to come back. And if my patient was female, I could tell her that she needs to wipe her labia, separating like this, wipe side to side, front to back, and then in the middle, making sure you use different strokes of the towelette or washcloth, and making sure the perineal area doesn't touch or the hair doesn't touch the specimen container. And then if my patient is uncircumcised, you'll need to retract his skin and making sure to retract it back. Then now my specimen is ready. I will put my specimen label in the specimen container, checking sure the facility policy, what is required for the specimen is all labeled out, and then put in the biohazard bag and seal it and take it to the lab immediately, or refrigerate if we don't have the lab nearby. And I'm going to take off my gloves, making sure my patient is in safe position, perform hand hygiene, the call light is in place and series are up. I'm going to document the color, order and clarity of the urine and explain to the patient that I will come back to check on him later. And if he has anything, don't forget to give us a call and we'll be right back, and my skill is done.